We're going to talk about how to remove an IV. Step one is making sure you have a reason to remove the IV before you actually remove it. Either the IV has gone bad, your patient's discharging, maybe they have like 4 of them that were put in by EMS when they came in, and now they really don't need that many IVs. But the reason I say this is because you never want to remove an IV until it's either no longer working or you need to remove it for a different reason, because it's not good to just not have access. Next, you're going to want to make sure that you don't have anything hooked up to the IV when you're removing it. So like right here, this IV line, I would go ahead, take that off. You're also going to want to make sure that your patient's coagulation factor is okay. It's not as big of a deal for just like a peripheral IV, but if you have a patient that's like bleeding a ton, like you're going to know that they're bleeding type of ordeal, then we may want to hold off on removing a peripheral IV, or if your patient like just got TPA or TNK, etc. But for your average Joe patient, even if they're on blood thinners, usually IVs are okay to remove. You just may need to hold pressure for a little bit longer. Next, you're going to want to gather your supplies. So I like to use 2x2 gauze, and sometimes I'll use tape, sometimes I'll use Coban. At my hospital, certain floors are not allowed to use Coban, so just look for whatever your hospital's policy is. But the majority of IVs should stop bleeding within like a minute or two when you pull them. So we don't really need like a super pressure dressing unless the patient is like prone to bleeding, like they're on blood thinners. Next, you're going to just start by taking off the tape around the IV. I like to tell patients that this is the hardest part because truly taking the IV out is not a big deal, but taking the tape off can be a little uncomfortable. You can always use like alcohol or the Detachethol little ampules to help loosen up that sticky stuff. I like to get all my tape removed all the way around, so that way all I have to do is pull the IV out. And before I pull the IV out, I will take my 2x2 gauze and I will actually hold it over the site, not putting too much pressure, just kind of holding it there. So when I remove the IV, I just go ahead and put pressure with that 2x2 gauze. I'll either hold pressure there for a minute or so, or I'll have my patient hold pressure, just depending on if the patient's able to or not. And then before I put the tape or Coband on, I will make sure that it has stopped bleeding. Again, this usually takes like maybe a minute or two, a little bit longer if a patient's on blood thinners, but we want to make sure that the bleeding hasn't just stopped externally, that you're also not getting like a hematoma puffing up around the area. And then of course, make sure you follow up with your appropriate documentation as far as that you took the IV out and that the catheter was intact. And that's pretty much it. Let me know if you have any questions.